Okay, so welcome back. So let's finish the muscle of the pectoral region. So first one is let's finish the muscle of the pectoral region. So we stopped at the action of latissimus dorsi. So we have abs in extension, adduction, and medial rotation of the arm. Then it also helps in what respiration. Okay, so one thing you have to notice is what all the muscles that attaches at the bicipital groove, that is the P major, teres major, and latissimus dorsi. All of them does abduction and medial rotation of the arm. Then I think this is the action, then unique feature. So what do you have to know about this guy? So the first thing about this muscle is that it has a it's the only muscle of upper limb. So first of all, it is, let's say, let me start with this one. It's called climbing slash swimming muscle. Then the second one, it has wide origin with narrow insertion. Wide origin with what? Narrow insertion. Then the next thing you have to know about this guy is that it is the only muscle of upper limb with pelvic attachment. It's the only muscle of the upper limb that have what? Pelvic attachment. The pelvic attachment is to the iliac crest. Then the next one is this guy covers the lower half of the back. Lower half of the back. Then the next one is it has triple relation to teres major. I call them PIA. So the first, it is first, it is fair at first, it is posterior to it, then now become inferior to it, then now become anterior to it. So we say that the relationship between latissimus dorsi and teres major is what? Posterior inferior anterior, or you say anterior posterior. That is anterior posterior inferior, or just posterior. If you just know it this way, firstly it was posterior to it, then later it become inferior to it, then finally it becomes what? Anterior to it. Then the last one is this muscle participates in the formation of two triangles. Participates in the formation of two triangles. So what are the two triangles? Triangle of auscultation. Then the second one is a lumbar triangle of petite. Lumbar triangle of petite. Lumbar triangle of petite. Okay. Triangle of auscultation and lumbar triangle of petite. Okay. Then let's talk about the boundaries of this triangle. Let's talk about boundaries of these triangles. So triangle of auscultation. What do you have to know about this guy? Let's say the first one is the boundary. So it's located at the back. So this muscle is located, this triangle is located at the back. Then, if you are not talking about the boundaries, it has three boundaries: superiorly, inferiorly, and medially and laterally. So superior is formed by trapezius, inferior is formed by what? The latissimus dorsi. Then lateral is by medial border of scapula. Then what form the floor of this muscle is rhomboid major. rhomboid major. Then what do you now have to know about this muscle again? What is the function of this muscle? So this muscle, you should know is that it is the only part of the back not covered with muscle. So triangle of association is the only part at the back around this side. Don't know if you can see it. That is not covered with what? Muscle. So this triangle of auscultation, this is where we use to check the breath sound. That is breath sound from the lung at the back. You understand? So you normally place the stethoscope there, then listen to the what? The sound. That is a breath sound from the lung. So that is the function. It helps in taking breath sound from the lung. Then the next triangle is lumbar triangle of Petit. So lumbar triangle has anterior boundary, posterior boundary, and inferior boundary. Inferior boundary is by iliac crest. Anterior boundary is by what? External oblique aponeurosis. And posterior boundary is by latissimus dorsi. They have three boundaries. Anterior triangle by external oblique aponeurosis. Posterior boundary by latissimus dorsi. Then inferior angle by what? Iliac crest. So we're done with latissimus dorsi. So then after is subclavius. You know, we started with those bigger muscles, which is level party LP, latissimus dorsi and pectoralis major. Then let's now look at what? The STRSP. So let's start with subclavius. The origin of this guy, the insertion, the nerve supply, the action, the unique feature. Okay, if you come to the origin of this guy, is um, costochondral junction of the first rib. That is the costochondral junction of the first rib. That is junction between the costal cartilage, first costal cartilage and the sternum. First costal cartilage and the first rib. Costochondral junction of the first rib. Then insertion is at the subclavian groove. This subclavian groove is located at the inferior aspect of the middle, that is a inferior aspect of it's the middle of the inferior aspect of the clavicle. Let's say this is the clavicle, this is the inferior aspect. You understand? The middle of inferior aspect of the clavicle. That is where we locate the subclavian groove. Then nerve supply is nerve to subclavius. Then action. So the first one is act to action. It prevents the the subclavian vein from the jagged end of the clavicle. Jagged end of the clavicle. Jagged end of the clavicle. So the second one is steadies. It steadies the clavicle to the sternocostal joints. Sternocostal joints. So that is it ensures the stability, the stabilizing. Or you say it steadies or stabilizes the clavicle to the what? Sternocostal joint. That is sternocostal joint. Junction between the sternum and the sternoclavicular joint. Sorry, that's what I mean. Sternoclavicular joint. So it stabilizes the clavicle, or you say you steadies the clavicle to the what? Sternoclavicular joint. The unique feature, the only thing we can say about this guy, can say it is enclosed. So it's one of the muscles enclosed by clavipectoral fascia. But when we do clavipectoral fascia, you see it. It's enclosed by clavipectoral fascia. It's enclosed by what? Clavipectoral fascia. Okay, then I think we are done with this guy. We are done with this guy. So let's look at trapezius. So let's look at trapezius. What we have to know about trapezius. So the same way, origin, insertion, nerve supply, action, their unique feature. Okay, then if you come to origin of this guy, so the origin of this guy, I will say, let me give one for the acronym. One third son, um, one third son, one third son plus EOP plus line of C Ronaldo till T12. One for the acronym. One third son plus EOP. One third son plus EOP plus line of C Ronaldo till T12. So what do I mean by one third son? That is one third of superior nuchal line. That the son means superior nuchal line. Then EOP means external oblique protuberance. Protuberance. Then plus line means ligamentum nuchae. Ligamentum nuchae. Then C Ronaldo to T12 means C7 to T12 vertebra. So meaning this guy is originating from one third of a superior nuchal line. Is also originating from external oblique protuberance. Is also originating from ligamentum nuchae. Is also originating from what? C5 to T12 vertebra. Then if you come to insertion, this guy has three fiber. We have can say upper fiber, middle fibers, and lower fibers. Okay, upper fiber, where does it insert? It inserts at the posterior aspect, posterior aspect of lateral half of the clavicle. If you remember, if you come to the anterior aspect of the clavicle, the medial half gives origin to clavicular head of P major, then the lateral half give the lateral half of the anterior aspect of the clavicle gives origin to what? Gives insertion to what? Sorry, gives the origin to deltoid. Then at the back of that lateral half, which is now the posterior aspect of the lateral half, is where upper fibers of the deltoid insert. Upper fibers of trapezius. So what you have to know is that the insertion of trapezium is inverse to the origin of deltoid. So this middle fiber will now insert at the medial border of acromion. Then acromion process, that's the acromion process. Then the lower fiber We now insert at the superior lip, superior lip of the spine of the clavicle, the spine of the clavicle. So when we now do deltoid, you see that the origin of deltoid will now be inverse of this. So the origin will now be from a lateral body of acromion, inferior lip of the spine of the clavicle, and the anterior aspect of lateral half of the clavicle. Okay, so this is the insertion of this guy. Then for nerve supply is supplied by spinal accessory nerve. So this guy, spinal accessory nerve is cranial nerve number 12, number 11. Now when we do head and neck, you see that accessory nerve has two roots, spinal root and what? Cranial root. So it's the spinal root of this accessory nerve that supplies this trapezius. This guy also supplies this spinal root also supply the sternocleidomastoid. That one is head and neck. Then let's continue with action. So this upper fiber, middle fiber, lower fiber, they do different things. Upper fiber elevates the clavicle, elevates the clavicle, sorry, elevate the scapula. So upper fiber elevates, helps in elevation of the scapula. Then middle fiber, this middle fiber helps in retraction of the scapula. Then inferior fiber helps in what? Uh, this inferior fiber, it helps in protraction, that is forward movement of the scapula. Protraction is like this. So it means that trapezius can do like this, can help you to do like this. Do you understand? It can, if there is elevation, it can help you to retract. Do you understand? And it can help you to protract. So it helps in protraction. So lower fiber helps in protraction of the scapula. The lower fiber helps in what? Protraction of the scapula. Then when this all this fiber comes together, you see that another action is that this trapezius, that is the between fiber, helps in what? Elevation of the head, hand above the head. Do you understand? Then when we talk about that is abduction of the arm. You see that 0 to 15-degree abduction of the arm is done by supraspinatus. Then 15 to 90 is done by middle fiber of deltoid. Then more than 90, that is abduction of the arm above 90 degrees. That is as is a like in terms of what? Raising your hand above your head. Is now done by serratus anterior and trapezius. Okay, I think this is all about action. Then unique feature about this guy. So the first one is what? We can say that it helps you to stand like a soldier. Like now, for example, soldier used to do like this. First soldier can salute, it will do like this. Make it like want to stand like a soldier, he will first of all elevate the clavicle, that is the clavicle and the scapula, then retract it. That is like this. You understand? So that's why we say it helps in what? So one of the things it helps us to stand like a soldier. Then next, number two is what? You already see it, look at it. It's the only muscle of upper limb that is not supplied by branch from brachial plexus. So trapezius is supplied from a cranial nerve. Do you understand? So it's the only nerve that is not only branch of brachial, only muscle of upper limb not supplied by branch from the brachial plexus. I think we are done with this guy. Okay. So after trapezius, let's look at the rhomboid. We look at these three muscles. If you remember the dorsal nerve, look at when we did brachial plexus, we supply the rhomboid and what levator scapula. So we'll understand this rhomboid when we do both of them with what levator scapula. Also, I want us to do levator scapula first. I have reasons levator scapulae. So levator scapula So levator scapula originates from C1 to C4 vertebrae. That is the origin. C1 to C4 vertebrae. Then insertion. Okay, let's say for example, if you come to clavicle, scapula, sorry, we have a medial border and lateral border of the scapula. Then if you come to the what? Medial border of the scapula now, we have what? Dorsal aspect and ventral aspect. The ventral aspect is for insertion of serratus anterior, while the dorsal aspect is for those aspects of the median border is for insertion of what? Levator scapula, rhomboid major, and rhomboid minor. So rhomboid major will insert at the what? Dorsal aspect of the median border of the scapula from the superior angle to the base of the spine. Okay, look at. Let's say for example, this is a scapula. So how to know the back of the scapula is this spinous process that projects from it. So you see that what? This is a um so this is a superior angle. This is the inferior angle. So you see that the muscle that inserts like this one is what? Levator scapula. Then the one that inserts at this those aspects of the medial border at the level of the spine is rhomboid minor. Then the one that inserts from the base of the spine down to the inferior angle is now rhomboid major. Do you understand? So that is how they insert. So you see that this guy is from the superior angle to the base of the spine. Then at the level of the base of the spine, then from the base of spine to the inferior angle is rhomboid major. This is the insertion of the three of them. Then if you come to the origin, this one is from C1 to C4 vertebrae. This one is from C7 and T1 vertebrae. Then this one is now from T2 to T5 vertebrae. So these three muscles, the origin and insertion, they look alike, like they follow themselves. So we already know the origin, the insertion, the nerve supply. All of them are supplied by what? Those are scapular nerve. Then action from the word elevator scapula, it elevates the scapula. Elevates the scapula. It elevates the scapula. Then, no unique feature about this muscle. Then, if you're not talking about, say, we are done with this, we're done with this, let's do the 2R. If you come to R minor, we have talked about the origin. The origin is what? C7 and T1 vertebrae. C7 and T1 vertebrae. Then insertion is what? Those are aspects um, those are aspects of the medial border of the scapula at the what level of the base of the spine. Look at it. Those are aspects of the medial border of the scapula at the level of base of the spine. Then the next one is a nerve supply. It's still what? Those are scapular nerve. Then action, retraction. So action is what? Retraction of the scapula. Then we are talked about origin, insertion, nerve supply, action. No unique feature about this guy. Then let's look at the last one, next one, which is rhomboid major. So rhomboid major, you already know the origin. What is the origin? From T2 to T5 vertebrae. What is the insertion? Those are aspects of the medial border of the scapula from the base to the inferior angle. The nerve supply is still the same thing. Those are scapular nerve. Action is still the same thing. Retraction of the scapula. Retraction of the scapula. Then unique feature. Yes, this guy have unique feature. We say that it forms the what? Floor. It forms the floor of triangle of auscultation. It forms the floor of the triangle of what? Auscultation. Okay, I think we are done with this guy. Then, so we're done with this. So it's now remaining status and 2 and P minor. So let's look at P minor first. A little bit smaller. So P minor. So P minor. So the P minor, the origin is third to fifth rib. Then insertion, anterior aspect of the medial border of the coracoid process of the scapula. So when we look at it, you see, as we go, I will be going like as we discuss. You see that the coracoid process has 3 muscles here that it attaches. If the arrangement from medial, from lateral to medial, is BCP. BCP, bicomplex, please. So B here is these 2 muscles are originating. This one is inserting. So this is short head of bicep. The B is bicep, but short head of biceps. C is coracobrachialis, then P is P minor. P minor is most medial and is inserting. Why these two, short head of bicep and coracobrachialis, they are originating from the tip of the coracoid process. Okay, then origin, the nerve supply, you already know is lateral pectoral nerve and medial pectoral nerve. So making it a hybrid muscle. And also the P major is a hybrid muscle. Then action, action. So number one, it helps in respiration. You know, it attaches to the rib, so it helps in what? Inspiration. Then remember that more than 90-degree abduction of the arm. Yeah, remember I say it's done by serratus anterior. Okay, sorry, it's not this. So this guy helps in what? In it helps in inspiration. That is the first action. So it said that it steadies the ribs during what? Inspiration. So that is one of the function of what? Action of this guy. Then let's talk about the unique feature. The unique feature. So this guy, what is one of the unique features is that it forms the anterior boundary of the axilla, or anterior wall of the, so from the anterior wall of the axilla. Then another one, it is enclosed by clavipectoral fascia. Clavipectoral fascia is enclosed by clavipectoral It is enclosed by clavipectoral fascia. You already know this guy is a hybrid muscle. That is another thing about it. Then I think we have talked about it encloses the clavipectoral fascia and it forms the anterior wall of the axis. Okay, so these are the what? The unique feature about what? Pectoralis minor. Then the last one, which is the what? Serratus anterior. Origin, insertion, nerve supply, action, unique feature. So origin, it originates with eight digitation, eight digitation from upper eight ribs. Eight digitation from what? Upper eight ribs. Eight digitation from upper eight ribs. Then for insertion, you see that first digitation, first digitation inside. Remember, I told you that senatus anterior inserts at the what? The medial border of the scapula. Abi? Sorry. Yes, the ventral aspect of the medial border. So the first digitation is inserts at the what? Superior angle of the, that is inserts at the superior angle of the ventral aspect of the medial border. Then second and third digitation insert at the whole of the medial border, the whole of the what? Ventral aspect of the medial border. Then fourth to eighth digitation, all of them join together to insert at the what? Ventral aspect of the, that is a inferior angle, that is a medial border of the inferior angle of the media of the ventral aspect of the medial border of the scapula. So this one is what? You know, I'm categorizing this just like, let's say, normally, let's say this is clavicle, sorry, scapula. You know, this is what? Superior angle, this is what? Inferior angle. So you see that what? First digitation is here. Then second digitation span up to this point. This is the second and third digitation. Then you now see that the last five digitation join together to insert at the this media ventral aspect of the medial border of the towards the what? That is the towards the inferior angle of the ventral aspect of the medial border of the scapula. So this is what? So this one, have you seen this last five digitation is here. That is fourth to eighth digitation. Do you understand? Then second to third, the whole of the what? Ventral aspect of the medial body. Then for nerve supply, you already know is long thoracic nerve or nerve of Bear. Nerve of Bear, that is another name. Then the action is a powerful protractor of the what? Of the arm. Yes, it's the arm of the humerus. That's powerful protractor. That's why we call it punching muscle. Then another action of this guy, so protraction, is the major protractor of the arm. Then the second one, it helps in respiration. Do you understand? It helps in respiration. Then the next, it helps in respiration. So you have attachment to the ribs. Look at it. It helps in respiration, particularly inspiration. Then the next action of this guy is that it helps in elevation of the hand, of the that is the arm above the head. Remember, I said that more than 90-degree abduction is my serratus anterior and what? Trapezius. So this P minor, please, I remember again in the action, it also helps in what? Protraction of the arm. But the major protractor of the arm or the shoulder or forearm or the humerus is the what? Serratus anterior. Then unique feature. What do you have to know about this guy? It is called punching or boxing muscle. Punching slash boxing muscle. Then another one is weakness leads to winging of scapula. Then if you come to this origin, this first digitation originates from first and second rib. That is another thing. Why the other digitation originates from their corresponding ribs. Meaning that what? Second rib has two digitation. That is, remember I said first digitation originates from first and second rib. Second digitation originates from second rib. Third is now third, fourth, fifth, sixth, seventh, eighth, eighth. Meaning that the one that have two digitation is actually the second rib. There is two digitation is attaching to the second rib. Okay, then I want you to know that this five lower five digitation, they are the strongest of the digitation, they are the strongest, and they helps. Okay, just know that what? Yes, that this lower five digitation are the most powerful digitation. They are the most powerful digitation. They are those digitation that are really, that helps to what? Rotate the glenoid cavity so that the hand can be raised above the arm. That's that point. So that is why I say that they are the most important. So they are the one that helps mainly in the elevation of the arm above the head. Then serratus anterior, you should also know it forms medial wall. We did it in axilla. It forms the what? The medial wall of the axilla. Medial wall of the axilla. Medial wall of the axilla. I think this is all for the what? Um, Muscles of the what? Pectoral region. So please stay tuned for the muscle of the shoulder and forearm and hand. That is shoulder and forearm and hand. And also do it to subscribe, tell your friends. Bye. See you guys next time.